Sorry for the delay and welcome to our session as part of the International Alliance of Academies of Childhood Disability Listening and Sharing Sessions 2023. So these sessions, as you probably know, bring you 24 hours of discussion from over 30 countries, and this is the Irish one, and it's being hosted by ourselves here in Central Remedial Clinic. My name is Rory from the CRC, and we're doing this in conjunction with the CP Life Research Centre in the Royal College of Surgeons of Ireland, and Dr. Jennifer Ryan is here with us from there as well. So just before we start, I just want to do some brief housekeeping. So as the slide shows there, this session is being recorded and the recording will be shared on the IAACD website, and the link to that is there on the left of the screen. So if you do not wish to be recorded or you would like to remain anonymous for any reason, that's fine. But just remember to keep your video off, don't comment on the chat, and importantly as well, remember to rename yourself as participant or similar on the screen if you don't want your name visible for whatever reason. So you can be doing that now. And we encourage questions and comments at the end of our session. And just remember, by actively participating, you consent to your appearance and comments being recorded and to be used with the recording of this meeting. Okay, so a brief outline of our timetable there, and I let people introduce themselves. So first off, we're going to have Sinead and Paul, who are going to talk us through their experiences of living with disability, and that will be moderated by Amanda from CRC. At about 2:30 or 2:30, we'll have Dr. Jennifer Fortune from RCSI, who will share her findings from interviews with young adults around transition into adulthood. And then lastly, we'll have Miriam McCleary from the CRC, who just gives some comments and quotes from a pilot project that they ran for adults with a disability here in the CRC. And then lastly, as you'll see, we'll have time at the end for questions and answers. So the chat is open, so please feel free to use that to put your comments or questions, or if you want to share anything, you can use that and we'll get to that at the end. So thank you. So because we were a bit late, I'll hand over straight away to Amanda from CRC, who's going to introduce Sinead and Paul and lead that discussion.
All right. Good afternoon, everybody. I'm here to facilitate a bit of a chat, as Rory said, between Sinead and Paul. I'm Senior Social Worker here in CRC, and I'm really delighted to be able to have this conversation with Paul and Sinead. So I'm going to just first by asking Sinead, if she's all right, introducing herself, tell us a little about her condition and kind of what you were like as a kid and growing up with cerebral palsy.
Okay, my name is Sinead Waldron. I'm 36 years old. I have a spastic diplegia kind of cerebral palsy, so it affects both my legs. So it's across both my legs rather than being hemiplegia down one side. So what was I like as a child? I was very chatty and curious, and kind of kind of curious and intelligent, interested in learning things, and interested in kind of reading, and a friendly, kind of outgoing little girl, I think. So I've always been able to walk. I've never been a wheelchair user. When I was small, I would have attended the CRC preschool and then transitioned into mainstream primary school, secondary school, and then went onto university. I would have used a walker as a small child, and more recently, again, I've started using a walker in the last couple of years since I became pregnant and had a baby. That's affected my mobility, and I've gone back to using a walker. So that's me in a nutshell.
Okay. And did you like coming in and out to appointments and things like that for your CP, or what was that like for you?
No, I probably was quite reluctant. We were very lucky in that the Central Remedial Clinic in Clontarf, in Dublin, by chance, was very near where my mother lived when she had me. So it was very local to us. That was complete fluke and chance. So it was very much within the vicinity. So in terms of the logistics, I know people sometimes have to travel really far to access services. We didn't. So that was one blessing, I suppose. I was probably always a bit reluctant to doing physio, and probably still am, and that's something I still have challenges with. And I remember enjoying going to the preschool, but I think it was the right thing for me to transition to mainstream school. Although that had its challenges, it was definitely the right thing for me to do.
Yeah, okay. Thanks, Sinead. We'll be back to you very shortly. But just for Paul, would you like to introduce yourself in a similar kind of way?
My name is Paul Grinnell. I'm 53 years of age. I suppose as a child I was outgoing, probably a bit too outspoken. I suppose my parents thought I was always kind of getting into trouble. I was try to kind of fit in with the local kids because it was because of my disability, which is spina bifida. It was kind of hard because I use crutches. But I used to get involved with soccer, and whenever there was a soccer match, I was number one to be picked from the team because I was had the advantage in goal with my crutches.
So you're a favourite. Yeah.
I was good at saving the ball. I had the advantage with the crutches. I went to the CRC, Central Remedial Clinic, and it was a reasonably good experience. I needed a lot of physio. I walked with crutches back then, but now I've kind of wheelchair and crutches now.
Yeah. And were you a bit the same as Sinead, a bit reluctant to kind of come in, or did you find it okay?
I found it okay. I suppose, like Sinead, I hated physio. It was like a form of torture, you know.
Yeah. But you kept coming.
Oh, I kept coming. Yeah.
Okay. And how did you keep going? Like doing things like, how did you get involved in any sports or anything like that when you were a kid?
Yeah. I was heavily involved with the Scouts.
Yeah.
And I did a lot of hiking. Hiking not just in Ireland but over in England, and we did a lot of camping as well. If I give you a funny story, we were all going to climb the Sugarloaf one day, which is about let's say 1,600 feet. So I was told I was to stay in the bus and they'd be back in a couple of hours. Of course, I wasn't having any of this, so I climbed anyway, and halfway through I found that I couldn't go any further, so I dropped my crutches and climbed all the way up. Now, coming down, of course, I was a lot quicker.
Okay.
By the time I got to the bottom, I had my trousers were in tatters. But I was always kind of busy, and I kept involved with sport. Yeah. And at a community level, I've also I've represented Ireland nationally and internationally in track and fields, shot put, racing, and swimming, and basketball.
Yeah. So you're a busy lad.
I was quite busy. Yeah.
So you kept all that up. Yeah. So I suppose the main theme of today is what the question we had for you, and our theme of our event is what I know now that I wish I knew then. So it's to kind of reflect back on advice that you might have given to your younger self to kind of keep yourself going as a teenager, but into adulthood as well. Was there any advice that you think that would have been helpful to keep you going during that time, and maybe in your 20s and your 30s? So I might put that to Sinead, if that's okay.
Yeah.
First.
I've reflected on this, and I kind of ran out of the CRC and ran out of services when I was about 18, 19, because I was discharged because I was doing so well, and I was kind of managing very well, and I was actually delighted to be discharged, and thought, oh, I'm heading off to university, I'm off to start my adult life, this is great. With my mom kind of coming up the rear behind me, who would have always been a very strong advocate for me, kind of saying to the CRC, "Oh, do you think she should be discharged? She does fall a lot." I suppose that's how my CP would affect me. As I said, as a young adult and an older child, I didn't use the walker anymore, and I was told I didn't need to use it, but I would have well, that was on physio advice at the time, as far as I remember. Like by the time I went to primary school, I wasn't using the walker anymore, and the only surgery I ever had was my Achilles tendons were stretched, elongated, just when I was about 3. Um,
Mhm.
when I was a small child, preschool, and then it was just a kind of bit of regular physio in the CRC, and well, as I said, I transitioned to mainstream school then. So by the time I got to 18, 19, I was finished school and I was heading off to university. Um, you know, the attitude from the CRC was, off you go, you know where we are, you've done really well. And I thought, great, yeah, this is great. But my mom had concerns still in terms of, you know, I would fall very regularly. Now I'm lucky to never really seriously injured myself. Um, but my balance wouldn't be great. My gait is obviously affected because of the cerebral palsy, that you know, affecting my legs. And what I wish I knew then then that I know now is that actually I couldn't confine the disability and management of it to childhood. I almost thought, right, I've been discharged, I'm grand. I don't need to manage this anymore. Physio is something I did as a child. But actually the falls continued. And as I said, I haven't injured myself, thank God. But really, I needed to maybe more actively manage it as an adult than I did in hindsight. And it was only in the last couple of years. I've had a baby. She's 1 year old later this month, and it was only in pregnancy when I had a fall when I was 15 weeks pregnant. Now, luckily, there was no adverse consequences. But I thought, you know what? The risks here have changed. It's not just about me. I can't risk falling. I'm now carrying a baby. Um, and I kind of had the cost benefit, the risk analysis became different. So I went back to physio, linked back in with the CRC physio, back in linked with the physios in the maternity hospital, and kind of engaged with services again. And it was only pregnancy that really prompted me to do that, because obviously my body changed, my balance changed, my mobility changed, and my attitude had to change then as well, because it wasn't just about me, it was about this baby I was carrying, but also the child I was going to bring into the world. I had to kind of reconsider things and link in with OT, occupational therapy, around managing the pregnancy and managing with an infant. So that really prompted me to link back in with the CRC and other services in the last year or so. And I'm very glad that I did. But the learning out of that is that really, I wish I had known when I was younger that this was something I had to own and had to manage myself, and just trying to manage on my own and actually act. My attitude, because I was managing quite well, was pretend that it isn't an issue, pretend that I don't need to manage the CP, that I can just get on like everybody else. And at times I think I overcompensated and tried to be, you know, so kind of managed so well that in a way that maybe no one would notice that I had a disability, or you know, it wasn't just say I fall and I jump up and say it's not an issue, it's not an issue, it's grand, it's grand. But actually it was. Maybe emotionally I was kind of a bit bruised after a fall, and physically maybe I was a bit hurt, and I wasn't really dealing with it or dealing with, you know, the condition myself, and I wasn't managing it. So what I wish I knew then that I know now is you have to own it and manage it yourself. And it's only due to pregnancy and having my own baby that my attitude has changed, and I'm now really kind of trying to own it and manage it and accept it in a different way. And what I wish I knew as well was it's okay to ask for help. There's no shame in asking for help. My attitude, my way of coping was to never ask for help, never admit that it's a problem, never accept any help. I didn't accept any accommodations in school, went to mainstream school with, you know, went to very supportive schools, particularly my secondary school, Mount Temple in Dublin. Brilliant, really progressive, really supportive school. Went on to Trinity College, they were very supportive. But I was really reluctant to accept help when I needed it, or accept accommodations. Didn't want to do my exams in a different centre, didn't want extra time, rejected all of that, even though it was offered, because I wanted to do everything like everybody else, which was really adaptive up to a point, but meant that there have been periods of my life where it's led to kind of burnout, because I've been trying so hard and kind of overcompensating so much, and wouldn't accept help when maybe I really needed it. And also, it meant that when I did need help, I didn't know where to go, or I didn't know maybe what I needed. because I'd never asked for it before, if that makes sense. It's hard to advocate for yourself and your own needs if you don't really know what they are, because you've been so busy pretending that you don't have additional needs, that when actually, like when I moved to a master's level, went on to do my master's and qualify as a speech and language therapist, which I later did. And when I moved into the working world, things became a bit more challenging, and practically I would have needed a bit more assistance, but I found it really difficult psychologically to ask for help, and and secondary, I didn't really know what to ask for, because I'd been getting on with it in my own way so much that when I did need help, I didn't know how to ask for it, and I didn't know practically what to ask for. So I wish I had, what I would tell my younger self is own it, manage it, accept it, come to terms with it, and ask for help. There's no shame in asking for help. You don't have to pretend like you don't have CP, which is what I did for a long time. You have to accept that you have it, and you're going to have to manage it, and it's going to change. And it was only a big life change like pregnancy and having a baby that really made me reflect on it and manage in a different way.
Yeah, brilliant. Thanks so much. Really good advice there, Sinead. I think just for Paul, have you anything that you would advise you would give to your younger self or to younger people maybe living with spina bifida at the moment?
Well, for me, I suppose the biggest problem that I had was when it came to go to a primary school, the local primary school were kind of reluctant to take me in, because they were afraid in case I might fall, or one of the students might crash into me or knock me over. But I found the biggest struggle was really through education. Because of my spina bifida, I had about 15 operations before I was 11.
Wow.
So I missed a lot of school. I missed a lot of school and struggled with that a lot. So as a result, when I was in the Central Meath Clinic, I came to 5th class, and it was suggested that I go into a workshop environment. Of course, I didn't want that, and my parents didn't want it. So I was lucky enough to have a teacher who saw a potential in me and decided that she would give me extra work. And with the help of herself and my parents, I was able to actually go on and do second level education. Now, I found that with second level education that they were trying to put obstacles in me. I actually missed the entrance exam, so they told me that we have a place for him, but it would be in a low grade with all the troublemakers. So my parents said, fine, he'll take it. So they said, we'll give him a month and see how he gets on. But fortunately, I was able to navigate myself around the school, climbing stairs. And now the first month I was exhausted, but things got better. And I was able to actually get my group cert, my group cert, my intercert, and my leaving cert. And then was able to go on to further education to college. Now, when I was waiting to go into college, I decided I wanted to be a chef. So I did home economics. Started home economics. Got that, went into college, and then they decided, well, it could be dangerous around the kitchen environment, so I don't think you'd be able to do that. So then I tried photography, and then again they said, well, maybe not photography, because what about the darkroom? There's all chemicals. If you might knock stuff over and cause an accident, you know? So eventually I went on to do computers and business. Now I was doing business studies and computers, and decided that I was more interested in the computer end of it. So I went on to do desktop publishing and information technology, and managed to get jobs in places like Compaq, Digital Ireland, and then went into the HSE, was there for the last 23 years, installing phones and telecommunication systems with Siemens.
Mhm.
And then I went on and did finance. I suppose overall, I found it is a struggle because I'd missed so much education, but I did manage to get
Mhm.
various disciplines like information technology and finance, and
Yeah.
I was quite proud of that, you know.
So you had a few knockbacks and a few misdirections, but you kept determined and to find your
Yeah.
niche and what would work for you.
I did,
And
yeah.
yeah.
And of course, in college is where I met my beautiful wife.
Okay.
Um,
So it was worth the journey.
So it was worth the journey, yeah.
Yeah. So is one of the messages, I suppose, Paul, not to take no for an answer and to keep pushing through and what you want to do for yourself.
What I would say to people is that if you want to do something,
Mhm.
don't let somebody stop you doing it. Don't let them steal your thunder, you know. And if
Yeah.
something doesn't work out, there's always time to move on to something different, you know.
Yeah.
But what I would say, probably like Sinead, is to ask for help,
Yeah.
because back then I thought I knew it all, and we don't, you know.
I think that's a universal thing amongst young people.
Yeah.
I think
Yeah.
I don't think we know it all.
Yeah.
Yeah. But there are times in life, isn't it, when you just have to reach out and get a bit more support.
Yeah,
And
I mean, there'll always be challenges in life, you know, and you'll have your good days and your bad days, you know, and
yeah.
plus the fact when you have a physical disability, it's hard to get around and you get tired, but it's okay to put your hands up sometimes and say, oh, I need help, you know.
And is that something you do now to help manage your condition? Do you think that you
I do, yeah, I do.
Yeah. Is there anything else that you do to kind of manage your spina bifida at the moment to keep healthy and well? Or
Well, there isn't a lot of kind of services out there, because I used to attend clinics on a monthly basis when I was up until the age of 18. But once you reach 18 here in Ireland, those services seem to stop. Now I do know that they do have these services in the UK, and they do further monitoring. I know this because my sister is a nurse and she works over in the UK, you know.
Yeah. So you just kind of have to keep on top of it yourself a little bit more with a bit of advice here and there, is it?
Yeah, well, what I tend to try and keep active.
Okay.
What I've in 2013, I just to prove to myself that I wasn't on the scrap heap, I decided to do a marathon, you know.
Okay.
Now that was a crazy idea, because halfway through it I had cellulitis on my left foot. So being me, I just said, well, I've raised a lot of money for a charity, over €1,000, which was at the time was Laura Lynn. Don't know if you heard of that charity, but I stuck a plastic bag on my foot over a sock in case it rained, and just went out and did it.
Well, okay.
And I was glad because I actually finished it.
Yeah, must be very proud of yourself. Yeah. But now you just still get out for bits, not quite marathon style, but you just get out and get a bit of exercise and try and keep yourself going.
My wife would be an avid outdoors type of person, so the two of us tend to go out as much as we can, and I do keep up the swimming occasionally when I can, you know.
Yeah. Great.
Now I have gone on since then, because of my disability and traveling and things like that. I'm more or less confined to a wheelchair, so I've kind of stopped working and decided to go down the route of finding work where I can do it maybe from home.
Okay.
I've recently done a diploma in graphic design, so now I'm going to try and go down that route, you know, and see what happens.
Yeah, well, best of luck with that, Paul. Yeah. And Sinead, is there anything you do to maintain your health at the moment, or anything you've had to adapt or change over the years?
Well, yeah, I mean, staying active is important. I try to swim when I can. I am probably not as good at doing. I did link back in with the physios and the CRC. Probably not as good at doing kind of prescribed stretches as I should be, which I think a lot of people with cerebral palsy and other conditions can relate to. As Paul was saying, I wouldn't at all be like Paul. I have great admiration for you doing that marathon and everything, and all the sports you've been involved in. Fair play to you. Sports were never my thing, and that's to do with the cerebral palsy, but I also think it's probably just how I'm made and it's my personality. I was lucky that I was kind of academic and, into books, and doing exams was quite like came easier to me. And so that's the route there my interest would be reading and watching films and going to museums and traveling, and it wouldn't really be sport. And I don't think that would ever be my thing, but I do try to keep active. And now I have a 1 year old that I have to almost 1 year old who's starting to crawl and is very active. I don't know how myself and her father are both met at university as well. And we wouldn't be sporty people, but she is already very active and very strong, and I think going to be quite sporty somehow. So we're starting to have to run after her, which has its own challenges, and in terms of it keeps me busy and active. But obviously, I've had to adapt and link in with occupational therapy and get some help around how to manage, because I can't carry her or lift her in the way other people, someone without a disability might. So it's been a challenge, but it's we manage and we're getting there. In terms of managing my disability, for me, it's been more sort of like psychological. That management piece, and I did do my undergraduate in psychology, so I would have an interest in psychology. But for me, the way of managing it has been in recent years to develop a greater level of acceptance around it. And like I said, I spent spent a lot of my kind of the years before this not managing it, and probably not really accepting it, because I could kind of get away with that because I was managing quite well and I didn't really have to accept it, and I had to adapt in my own ways. But I think because I was functioning very well, I kind of didn't see the need to accept it or really manage it. And now, as I said, I'm really starting to kind of accept it and own it and try to manage it myself. And I'm lucky that I've been able to access kind of private psychological support and intervention. But I do think there's a real need for adult services for kind of psychology and counselling for people with physical, any kind of disability, because life is just that little bit harder. I don't mean to sound negative, but as I said, I think I was overcompensating for it for years, and it did lead to periods of burnout and depression. And through my own psychological work, I realized that having a disability was probably where that came from. So at the moment, in terms of managing it, I'm managing it in terms of on a mindset level, because I think that's so important, because if the mindset isn't right and you're not accepting and kind to yourself about things, you won't engage in the other things to keep you well. You won't engage in the exercise. You won't engage with services because you feel you don't need them. So for me, I think I'm really working on the mindset and the acceptance of it, and that's leading to managing it in more positive ways in terms of exercise and adapting and things like that. And it's really been the birth of my daughter, pregnancy with my daughter, and her birth has made me feel, well, I want her, and having to go back and use the rollator has been the walker has been a big change for me, and something I really psychologically resisted. But the way I feel is I want her to be okay with a mum that has to do things differently and has to use a walker sometimes. And I can't expect her to be okay with it if I haven't dealt with it and I'm not okay with it. So I want it to be a positive thing and a thing we can talk about. And I think with mom, your mom has to do things differently, and this is why, So that's really challenged me. So in terms of managing it, it's more a psychological, emotional piece, mindset piece, and that's led on to other positive changes in my life. And engaging with the pilot project that's going to be spoken about later in the CRC has been really good in terms of getting that peer support and meeting other people who have similar experiences, because I wouldn't have had that before. And in fact, I would have probably resisted that because I would have been so busy being like, look, I'm functioning so well. I don't need to talk to other people with this disability, but there's a real support in linking in with other people who have similar experiences and know what it's like to maybe struggle that bit more or fall or who get it. There's a level of you need to find your tribe, you need to find support, And there's nothing like a bit of peer support, linking with other people who just get where you might be coming from. So that's how I'm managing as well, linking in with peer support, changing my mindset, accepting it, and managing it a bit more proactively.
Brilliant. Thanks so much, Sinead. We could talk for another hour, I think, here, but unfortunately, fortunately, we need to move on to the next part of it. I think we're already going to introduce our next couple of speakers, and there'll be a chance to, I think, if there's anything in the chat for you, if anyone has any questions, to link in you guys towards the end. So thanks so much, guys, and thanks for your time.
Thanks.
All of this. Thank you.
Okay, thanks very much, Sinead, and thanks, Paul, and thanks to Amanda for leading that discussion. And as you said, the chat is open, so please, if anyone has any comments or wants to share their own similar experience or any questions for Sinead and Paul, they will be staying with us. Please use the chat. So next we have Dr. Jenny Fortune from the CP Life Research Centre in RCSI, who's going to share her findings, or some of them, from interviews she did with young adults about what they wish they knew moving into adulthood. So thanks, Jenny.
Thanks so much, Rory, and it's just great to hear everyone's experiences so far. So I'm going to be sharing some feedback from young adults aged 16 to 22, and we spoke to these adults when they were moving from child to adult health services. And during this really important period, they discussed what they wish they knew and also how their support network could have helped them a little bit more as they transitioned from childhood to adulthood. So moving from childhood to adulthood, as Paul mentioned, can often be a big change. And to navigate these changes successfully, young people talked about the need to prepare for the changes and differences between child and adult health services. In adult services, they talked about how the focus is now on them rather than their parents. Adult service provided more detailed information and expected more from them. And they felt knowing about these shifts and expectations in advance would have helped them to adapt a little bit quicker. Young people also told us they often didn't know much about moving from child to adult services, and sometimes they only realised what they needed after they'd left. As this young person in the quote highlights, it's really important to seek information about how adult services works and what it's like. Try to start thinking about the changes before you leave children's services and start asking what is available for me and where do I go? And health professionals can support this by helping young people to access information about the transition and the available services. Young people also spoke about how they didn't know too much about their condition, and this made it hard to talk about their medical history and get the right support when they did move into adulthood. And they highlighted how important it is to learn about your condition, as being informed can help improve your experience in adulthood. And again, health professionals can support young people's understanding and helping them to know more about their health. And finally, moving from children's services is a big change, and it might take time to get to know your health professionals, especially if you're used to seeing your children's health professionals for a number of years. So young people advise just be patient with yourself as you figure things out in this new situation. It's normal to feel uncertain, but as time goes on, you'll start to feel more comfortable. Next slide, please. Young people also told us that as they got older, decision-making and responsibilities shifted from their parents to them. Adult service expected them to be more responsible, and there's different demands and expectations. Young people found it helpful when they were given more responsibility and encouraged to be independent gradually while they were still in children's services. And as this young person, the quote highlights, they started a gradual approach from when they were about 14 or 15. They went to some of the apartments by themselves. Their parents are still close by for support, but this made them feel more confident. And looking back, it really helped to ease this move to adulthood. Young people also talked about how they wanted to be treated as an equal partner in their healthcare. In children's services, they sometimes felt ignored when health professionals mainly talked to their parents. And this made them feel frustrated when they thought they weren't being listened to. And they emphasized the importance of trust and transparent communication and being treated as a capable partner in their care, not just like a kid. Health professionals can talk by talking to them directly and include them in healthcare decisions and discussions. And finally, young people, as they took on more responsibility in adulthood, the role of their parents changed from actively making decisions in child services to acting more in a support and advisory role. And sometimes it was hard for parents to step back because they worried about their young person managing their health and getting the support they needed. So health professionals can help by collaborating with parents to provide reassurance and information and supporting them to step back during this time. Next slide, please. And lastly, moving to adulthood, young people highlight this meant you had to speak up more for yourself, talk to new health professionals you may not know, and get used to health professionals asking you questions directly. Young people felt it was important that you start recognizing you're the expert in your health and that no one knows your health better than you. Recognizing the value of your voice and your opinions and your expertise was really important to help shape your healthcare journey. Young people also highlighted the importance of speaking up and expressing what matters to them. And as the young person in the quotation highlights, if you have preferences or goals or concerns or supports that you need to speak up and you need to say it to someone so they can hear your voice. And some of the ways you can practice is by taking part in your healthcare discussions and asking questions while still in children's services to help you prepare. Young people also shared how their parents encouraged them to advocate for themselves and to lead their healthcare discussions. And parents made sure that young people had chances to speak in a structured way. And some people did this by splitting the number of questions between parents and young people in appointments, or sometimes even just practicing the conversations before young people went into the appointment so they felt a bit more confident when they went to speak up. And finally, young people stressed the importance of having enough time and space to express themselves. Sometimes they felt they had to rely on their parents because they didn't have enough time in their appointments to say what they wanted to say. So health professionals can support this by making sure that young people have a little bit of time in their appointments to share their thoughts and by asking young people questions directly and giving them that space. And I'd just like to finish by thanking all of the young people who spoke to us and were so generous in sharing their thoughts and opinions.
Okay, thank you very much, Jenny. And lastly from us then, we have Muireann, who's going to share some feedback from the Complete Person pilot programme, which Sinead referenced earlier in her discussion, and some quotes that they got from that. So thanks, Muireann.
Thanks, Rory. So as Rory said, the next feedback that we're going to discuss is from some of the adults who attended an 8-week group living with a physical disability run by the CRC. And this group was part of, was one of the interventions that was offered to adults aged 30 to 65 who had a congenital physical disability. It was a national programme called the Complete Person Pilot Programme, and it was funded under the Strengthening Disability Services Fund. And of 27 adults who were asked the question, what I know now that I wish I knew then, it's a bit of a tongue twister, 10 responded. And I would really like to thank all of those 10 who've responded. And their responses will be just discussed now under the headings of knowledge about my disability and the physical and mental impact. Next slide, please. So I suppose in thinking about what they would tell their younger self, the adults did acknowledge that they mightn't necessarily listen as a young teenager, because there can be a lot of competing priorities as a teenager. But different level of maturities and interest at that age indicate that there's no right time to share information, and that I suppose what came across as being important was that information is shared and then that it's available and accessible to go back to and review as questions arise or as people become ready to listen to the information or have it more of an interest in it. Next slide. One of the recurring themes through the feedback was about knowledge and the importance of knowledge of your condition. And this, I think, echoes what Jenny found, that knowledge with the younger people, knowledge is power. And it really is essential to have a complete understanding of your condition. Because what was fed back was that knowledge of the condition may help in taking ownership and responsibility for exercises and may lead to more realistic expectations of yourself. They also highlighted the fact that while the knowledge about conditions is developing across professionals like consultants, GPs, physios, the person who knows most about how the disability is impacting on the individual is the individual with the disability themselves. They know their strength, they know their capabilities, and they know where they need help. So that's where it's really important to get that full knowledge. They also emphasised that we can be quite closed in where we're looking for knowledge and information, and that knowledge is available wider than just the medical professionals in Ireland. There's a worldwide sources of knowledge out there, and that it's really important to get as much knowledge about your condition and about various services and treatments that are available that may support you in easing your condition or improving your condition. And they advocated the importance of developing clear communication and learning how to communicate about your condition to be able to ask for help. Yeah, next slide, please. They also emphasised the importance of being aware that your condition may change. And for example, with cerebral palsy, while it's not a progressive condition, change related to the condition does occur. For example, secondary conditions such as skeletal deformities and muscular pain. They identified that this can result in premature aging symptoms, such as lead overall to a loss of mobility earlier than in the general population, and emphasised the need for the correct targeted exercises to be undertaken at an earlier stage to lessen, to support mobility and strength for a longer period. Also, knowledge about your condition and the changes might occur helps in future proofing and preparing for the future and in the best way possible for yourself. And they also highlighted a need to be constantly monitoring your disability and changes that are happening within your disability and going for help as those changes occur. Next slide, please. So the baddie, physical exercises. This importance of physiotherapy exercises came up again and again. It was again a recurring theme. And I suppose we've heard from Sinead and Paul that it's not necessarily the go-to, but it really was recognised as being really, really important. Recognised that it needs self-discipline and work, and that it is ultimately down to the individual to do it. But it was recognised as well that it's better than money in the bank if you're doing the correct, regular physiotherapy exercises at the right time, and that it will require patience and time and persistence. Next slide, please. As well as physical well-being, mental well-being was highlighted by the adults, and they advocated not to hesitate to talk to families and friends, both about your victories and your struggles, to start to develop a support network. And they advised that in looking at a support network, it's important to recognise, as Sinead said earlier, that it's okay to ask for help and to be brave, and identified that getting support from friends with a disability or a similar disability is a really good network, because these are the people that will understand your disability, will maybe be able to provide information, to share stories and have a good laugh with. They did also recognise that just because somebody has a similar disability to you doesn't necessarily mean that you will get on with that person. So that was a caveat that was in there. Next slide, please. Embracing your uniqueness was stressed, and the fact that it's okay to be different was emphasised. Looking after your mental health as well as your physical health, and that disabilities have mental and emotional needs as much as and as important as the physical needs to look after. It was identified that having knowledge about your condition can help develop self-compassion and acceptance of the disability and support mental health. Okay, next slide, please. So managing your condition involves incorporating targeted, bite-sized, small, little exercises often. And unfortunately, while healthcare professionals can help and give advice, ultimately the responsibility for doing the exercises, looking after the programs, managing your lifestyle comes down to the individual with the disability themselves, and owning that. Next slide, please. So the other thing that was emphasised was that a disability is unique to the individual who has it, and it's important to seek personalised advice with tailored programmes. Looking for bite-sized exercises that are easy to incorporate into your routine, and finding something that motivates you and that you're interested in, so that it can be integrated into your everyday life easily and it isn't a burden if possible. And establishing a consistent routine, but being able to adapt and diversify that as change occurs with your disability and as things change within your life is important. And next slide. So I suppose in summary, what the adults were saying to us, as you can see in these quotes here, is to be aware of the changes that come with age, and the changes do come with age. And it's important to be proactive about future proofing, because that proactivity benefits everybody. And ultimately that it's to remember to look after your mental, emotional and physical health at all stages. Okay, thank you.
Okay, thanks very much, Muireann, and thanks to everybody. So we have some time for questions or comments that people can put in the chat, or if anyone would prefer, you can please put up your hand or shout, and anyone's happy to take questions here. Because otherwise I have one, because I'm going to jump in there while people are typing or coming in. So I was interested, Paul, in particular, you had mentioned you had a number of surgeries and how they impacted on your schooling. And Sinead, I think you mentioned, you may have used the word you were fortunate you had only one, so and it didn't impact, but like, should it have come down to fortunate? Look, and that's what I'm wondering, Paul, in particular,
Yeah.
was how its impact on schooling and the other aspects of your life ever considered when they were planning surgery or setting goals for surgery at that time, or should they, do you think? more
No,
so?
what I think it was necessary for me to be able to walk properly without the use of wheelchair. I was fortunate that I had a very good surgeon. He was named Dr. Lavelle, who's since passed away, and he was the one that was trying new pioneering operations, you know. But he certainly, if he hadn't have done what he had done, I wouldn't have had the life that I've had, because I've done so much things and was able to get around, you know.
Okay, great. Okay. And Sinead, just wondering, I mean, yeah, maybe an unfair question because you were obviously a child at the time, but did that ever come into the planning of your surgery, or you know, fitting it around school, or
I don't, yeah, again, I only, like, I know fortunate is a relative term. I suppose I was saying fortunate in comparison to Paul, who had so many surgeries, and it's unfortunate, Paul, that you couldn't have been facilitated to kind of keep going with school. I don't know,
Yeah.
but maybe if it was now, you get more support in the children's hospital to keep up with schoolwork or
You
whatever. It's
would,
just
yeah,
unfortunate that there was gaps for you, that obviously
because
impacted you. That's unfortunate.
yeah, there was no kind of schooling in hospitals at the time.
Yeah,
No teachers,
yeah,
so you were just kind of left to your own. And your parents would
yeah.
kind of bring in homework, they
Bits of
bring in
work.
books and things for you to try and
Mm.
learn that way, you know.
I know. I hear what you're
Yeah,
saying about it having, that there were benefits for you physically, but
yeah,
it's. I also heard what you said about those
yeah,
gaps having in education having consequences for you. So I just
yeah.
hope that would be better handled now. The one surgery I did have on my Achilles tendons, my understanding, it was done preschool, and it was done not long before I went to primary school. So I imagine, I've never, I should ask, um, at home, that it was the timing of it was probably to get it done and get me recovered before I started primary school, and that was, and I think that was the plan, and that's how it worked out. And then I was able to move from the CRC primary school, CRC preschool, excuse me. I know I was there when I had it, and I would have had, and I was recovering. I was able to recover while being in that preschool environment, and then I think I was kind of recovered enough to be able to transition then into mainstream school, primary school in the September. So I'm pretty sure it was planned with that in mind, and that did work out. So it just shows how maybe there was a bit more planning went
Maybe there
on.
was to be give Kiva credit for looking that, yeah.
Yeah, that in the years that passed, obviously myself and Paul are different ages, so maybe by the time I was having my surgery, there was a little bit more planning around how to time it around education. So it, to my knowledge, it didn't disrupt my education. I know I was in preschool in the CRC when I had it, and I was recovering then, and then I was able to go to primary school, and then it was just kind of ongoing physio management. I didn't need any more surgeries, so that was good.
There's a question here from Dawn, which is kind of expanding on the theme. So maybe I'll come to you first, Sinead, because you mentioned the importance of psychology and that aspect of things. So Dawn, I don't know if you can see the chat, but I'll read it out. Dawn is just wondering there, do you think that your emotional well-being was considered when you were growing up?
Probably not. No, I mean, it would have been by my family, because I have a very supportive family. But no, I think that was a real oversight, and it's only as an adult. Obviously, I have to declare a bias. I have an undergraduate degree in psychology. I'm very interested in psychology, so. But definitely, I've had difficulties. I've had a lot of successes, but I've definitely maybe struggled to accept myself, and my disability has affected my self-confidence, and and through therapy as an adult, I've kind of realized that my own feelings about my disability were probably at the core of some mental health difficulties I've had, and I've had to work through that. But I don't think that was considered when I was a child growing up. I mean, I think my family were supportive, and it was always like, on you go, manage everything. You can manage anything. You can do what you want. And I really, my mom was I was brought up by my mom on her own. She was a great advocate. I did everything. Like I said, I transitioned to mainstream school. I got on with it, but and I was, and I was lucky, really lucky, in that I didn't experience any significant bullying as a child. I genuinely didn't. I went to really supportive schools, I have to say, particularly Mount Temple Comprehensive School in Dublin was wonderful, and I fit right in, and that was very accepting of difference, and still is, to my knowledge. So being a bit different and wearing my Doc Martens and doing my own thing was fine and cool. And then I went on to college, and sure, everyone's a bit different, and that was fine. So I didn't experience any outward discrimination in school at all. growing up. But there was stuff I suppose I was carrying around myself, around kind of shame or not accepting myself or feeling different. Or as I said, having to overcompensate, which led to sort of burnout and depression. And I think I would really love if there was some sort of psychology service beyond kind of assessments and cognitive assessments, which obviously is important when you have a disability, that everything is assessed and, learning abilities and things, but a counselling or support from that young age to build sort of resilience and build coping skills and self-acceptance and build self-esteem, because my self-esteem was definitely affected, although I didn't realize that, and you wouldn't have realized that by looking at me, because my attitude was, go on and give everything a try, because that's how I was brought up, and I was outgoing and chatty, but inside it definitely affected my self-confidence and my emotional well-being. But I don't think I considered that till I was an adult. And I don't think it was considered when I was a child. And it would be great if kids now, particularly into those teenage years where you're trying to kind of accept yourself, and we all have our differences, and it would be great if there was a bit of support around that. I think that kind of, those teenage years are tricky at the best of times, and when you have a physical disability, they're more tricky. And like I said, I was in really supportive environments, so it wasn't bullying or anything, but it was sort of internalized, feelings about myself. I think there's a real need for support around that time, and maybe support around self-acceptance, self-esteem, around relationships, how you navigate that whole world when you're a little bit different, around sex and relationships and stuff, to support people, because that's tricky for everyone as a team. But when you have a difference, like a physical disability, it's that little bit more, it adds that extra layer of complexity that I had to kind of navigate on my own as an adult, because that groundwork hadn't really been done. My family are great, but it would have been great to have a bit of intervention, kind of preemptive intervention, psychological intervention, especially in those teen years, around transitions and around self-esteem and growing up, and all the issues that throws up, that are a bit more complex when you have a disability.
For sure. All right, thanks, Sinead. There's another comment here from Darren. So I'll ask you, Paul, because clearly, as we've learned, you're not a man to let mountains or mountains stand in your way or be intimidated by them. So there's a comment there from Darren about when you're asking young people to take the lead at their appointments. There's two aspects of that. One, the young person has to be able and willing to step up, but the parents have to let go as well. So Darren's just wondering, have you any comments on that? Was that something that you came across, or that it impacted on you? Were you happy enough to start speaking your own mind at doctor's appointments, and did your parents allow you, or how did that work?
Yeah, well, I've always kind of, as I said, been a bit outspoken, and I suppose now with doctors, I find doctors don't, my own GP, they don't seem to know a lot about spina bifida, and they tend to treat you as an ordinary Joe Soap. I find that you have to kind of talk to them and maybe explain things to them, because I suffer a lot from kidney infections and things like that, and they tend to just give you medication and send you on your merry way. So I've never really shied away from doctors. I've always asked them what do they expect the outcome will be, and how it will benefit me.
Yeah. And when you were a teenager, maybe sort of coming into adulthood, were your parents happy to step back and let you take that lead with doctor's appointments?
Yeah, it came to a certain point. Well, I suppose after the age of 12 or 13.
Okay.
I had experience from going to many different appointments, so they tend to kind of pull back on the reins and let me kind of speak up for myself.
Very good.
Because at that particular stage, there was only so many operations that I could have had. Now, having said that, when I was 29, I had to go and have plates put in my back, and give an example, like that was a serious operation where they told me that everything that I had actually worked for, all the operations that I had, could actually be taken away if I went if I actually went for the operation and it wasn't a success. But I was given to me that you can either suffer pain for the rest of your life and be on painkillers, or you can actually go and have the operation and gamble and see if it works. Unfortunately, it did work, and things worked out well.
Great. And just maybe last comment, just maybe I go to the same kind of question for you, Sinead. I mean, you had commented that your mum was not that happy to see you skipping out the door here, so there was obviously a bit of a change in relationship there as to who was taking the lead on coming here or not. So any final comments on that?
Yeah, I think I was always interested and curious. So I probably always kind of piped up a bit in terms of appointments. Even as a kid, I can remember asking questions and my mom being like, I don't know, we'll have to ask the doctor. So I was also that kind of slightly precocious kid that had loads of questions and had loads to say. So I think our appointments were probably always quite joint enterprises between me and my mom. And then when the CRC discharged me, that was just the way it was, and they were happy to discharge me, and I was running out the door. But my mom did have concerns, and I remember her raising them. But obviously, the clinic itself were discharging me, so that was that. And like I said, it was only in pregnancy, and I came back, and I'm very glad I did. So it's those times of transition I think are really important. And Jenny Fortune spoke about those times of transition. I found that I would have always found that transitioning to secondary school primary school was a bit tricky, secondary school was a bit tricky, university was a bit, those transitions, and then pregnancy threw a load of difficulties at me. So it's those at times of transition, I think you realize that you maybe have more needs than you thought you did. And it's good to be able to come back to a service then. I think that's really important. But so yeah, I would have asked questions and stuff, but like that, I probably didn't really own my own condition. I didn't, and that thing about learning about it, I think I kind of should have learned more when I was younger. Wish I'd learned more. Like even the term diplegia, I only learned from Googling myself. I don't remember anybody sitting down to me and going, "This is your condition." And I would have actually really appreciated that in my later teen years, or even at 13, 14, I think I would have been able to do that and would have been smart enough and engaged enough to do that. If someone said, right, this is your condition, it's diplegic cerebral palsy, this is where you are on a mild to moderate level. Nobody really sat down and right, this is the score. And you will experience fatigue. I only as an adult have realized that I've dealt with with a lot of fatigue for my whole life, because I think I just powered through it for a long time. And it's only in my 30s, and particularly since I became pregnant, that the fatigue became a real issue. And I was like, it was only when I linked back in with the pilot project that I was like, well, of course I have fatigue. All these people have fatigue. It's part of my condition. Nobody ever explained that to me. I think it would have been really great if a clinician or a team of clinicians had sat down with me as a young adult and leveled with me before I ran out the door to university. It would have been really great to have that chat to someone and say, look, Sinead, this is your condition. This is the score. You're going to have to manage it. Your physio isn't just something you did as a kid. It's going to have to be something you're going to keep up. Now, having said that, I was so busy running out the door to college to go to lectures and go on trips and go drinking, that I don't know if I would have really taken that on board.
I think you took the words out of my mouth there. I was just about to say, would you have listened? Yeah, so
I
like
don't know.
every teenager.
I don't know, but if we're talking about what I wish I knew then that I know now, I wish someone had tried. I think if someone sat down with me, I was quite mature and in my own way, and I think if someone had sat down with me as an adult and like just leveled with me, just been like, this is your condition, this is what this is where you're at, this is your diagnosis, fatigue will be an issue, spasticity will be an issue, like we're discharging you now, but like we're here if you need us, and these are the things that might arise for you. I don't know if I would have listened. I like to think I would have.
I think that's a nice way of putting it, though. At least
that conversation. I think if that conversation had been had, that information, I would have at least had that information, and a door would have been left open. But it wasn't until I had difficulties in pregnancy that I had to link back in. I was lucky that I could, that I still live in Dublin, still live near the clinic, have been lucky enough to link in with the pilot project. That's been great. So I'm really lucky that these services have been available to me. But I just wish someone had just leveled with me, you know, as a young adult. Now, may not have listened, but I wish they at least tried.
Perfect. All right. Well, thank you
If that
very
makes
much.
sense.
Thank you. And thanks to everybody. Thanks to Paul, thanks to Muireann, and thanks to Jenny for everything there. Just to finish up, there is some QR codes there. So the top one is you can get the recordings of this session and all the other sessions at the IAACD website, which is listed there and linked to on the QR code. And actually a very nice one, as we're kind of talking about having information available to people, there's some fantastic transition stories available on the CP Healthcare Transition website. So there were videos put together led by Jenny, and they're a really great resource on people talking about their transition and in the context of their disability. So that's available there. So just to finish up, thanks very much to everybody for contributing. Thanks for joining us, and we leave it there. Thanks all.
Thanks very much. Thank you. Bye-bye.
Bye.